So once we have an idea as to how pancreatic cancer can start or can have symptoms, we must be very vigilant because pancreatic cancers are one of the few cancers which can get completely cured only in first couple of stages. When the cancer becomes big, it is very difficult to treat it, and if it spreads, it's even more difficult to control it. Unfortunately, your healthcare workers or your doctors are not able to palpate or feel the pancreas because it is deep inside the body. So, a general examination in early stages will not tell us anything about pancreatic cancer. So, if you have symptoms, we have to diagnose them or we have to take you through all the various tests, the radiological tests, the pathological tests, so that we can come to a conclusion of whether the person has pancreatic cancer or not. If the cancer in pancreas is very small, it should be operated upon. If a surgery is possible, that is the best option for the patient to live. Unfortunately, the place where pancreas is situated is very odd. So, getting a small tumor in the head of pancreas is very difficult. Sometimes a very small tumor can get diagnosed because it compresses directly on the bile duct or the common bile duct. Now, at that stage, even a small tumor of 3 to 5 can be diagnosed and then it is treated, and the cure rates are fantastic. But otherwise, because the gland is situated in such a situation that whenever there is obstruction, the tumor is already big and it is difficult to treat such tumors. If surgery cannot be performed upfront, nowadays we do try and see whether the tumor can be reduced in size, whether we can get good margins. Now here I must talk about margins. What are margins? See, whenever we try and operate a tumor, we don't go too close to the tumor and try to shave it off from the structures that are adherent to it or that it is adherent to. So what do we try? We try a rim of normal tissue around that particular tumor to be intact and remove all that. What I mean is, if the tumor is of a size of a table tennis ball or a ping pong ball, we try and remove a tennis ball sized tissue all around the tumor so that the malignant cells are not there on the border or on the cut margins of that particular sample or the specimen. The distance between the cut margin and the margin of the tumor is called as surgical margin. And in any kind of tumors, it is best to have negative surgical margins, meaning thereby there should be no tumor on the resected margins. Now, having said that, it is not possible every time that you get some kind of margins. So, in such patients, we try other type of therapies first, upfront, and once we are successful, then if we can downstage the tumor, then we operate on it later. Unfortunately, when the tumor goes from place A to various other places in the body, we say that the tumor has gone into fourth stage. And at that stage, it is very difficult to deal with pancreatic cancer. And we have to be really, really very cautious. And multiple other complications start because of that. For example, when the tumor is big, it starts abetting the bile duct and the patient starts getting jaundice. Once the patient is jaundiced, the patient doesn't feel like eating. The body resources go down. He feels or he starts feeling weak, so on and so forth, and a vicious circle begins. So it is extremely important that we diagnose any cancer, especially pancreatic cancer, at an early stage so that we can attempt a cure. Now, as I said, we do talk about something called as exocrine tumors of pancreas, and the commonest cancer in that is called as adenocarcinoma, in which actually the tumors of the duct and the gland itself start getting converted into malignant cells, and they are treated or dealt with in the standard treatment protocols of surgery, chemotherapy, and radiation. Nowadays, we are having extremely good results with immunotherapy for pancreatic cancers and in some cases also targeted therapy. So the horizons of success are expanding, but at the same time, we cannot forget that early diagnosis is the key to a successful treatment of pancreatic cancer. The remaining 7 to 8% of pancreatic cancers are called as neuroendocrine tumor. And those are the tumors which originate from the hormone secreting cells. So they are called as either insulinomas or some other kind of tumors. Now, these tumors require an entirely different treatment. They are also at times called as stromal tumors, etc. Their treatment differs. Everything is different. So please don't equate that this particular person had pancreatic cancer and this one also had pancreatic cancer, but their futures are going to be the same. No, they are not going to be the same. They are, in fact, going to be different. So we have to bear all these things in mind while we do such comparisons. Very often, unfortunately, today what happens is when something unfortunate happens with a patient, the relatives tend to blame the doctors that, oh, that particular pancreatic patient did well, pancreatic cancer patient did well, but this particular patient with pancreatic cancer did not. So there must be something wrong with the doctors. No, it is not as such. The tumors are different, individuals are different, and treatments are different, and their fates also are different. So let us remember this and try and make sure that we treat pancreatic cancer nicely, diagnose it early. Thank you.